Welcome to the Strength for Life podcast, where smart strength training meets real life. We're Dr. Matt and Nicole Klingler, founders of Village Fitness and Physical Therapy. Here, you'll learn what really works in the gym, at home, and for life. Welcome back to the Strength for Life podcast. I'm Dr. Matt Klingler, here today by myself without my wife, Nicole Klingler. I'm doing a special episode today just for the fellas. I'm going to be talking about how men can build muscle and strength as they age, and the specific things that are applicable to men and the things that men are prone to. I'm going to be talking about testosterone, the male hormone, and some of the things that drive up testosterone and help us to age well, and some of the things that drive down testosterone and cause us to age prematurely. And I want to start off by telling the story of the strongest, one of the fittest 80-year-old men I've ever seen in my life, and I saw a lot of him. So I was a personal trainer at the Davis Athletic Club after I graduated from UC Davis for about a year and a half before I started my doctoral work at APU. And I remember I walked into the gym one day, and out of the corner of my eye, I see this guy walking towards me kind of quickly. And I look, and it's Dr. Jim Shaffarath. He was one of my professors in undergrad, probably my favorite professor. And he tells me, "Klingler, come with me." And so I follow this guy into the men's locker room, and we go past the first row of lockers, the second row to the third and final row. And I vividly remember this. There was a naked older man who was quite well muscled, getting changed. He looked to be about 80-something years old. And Dr. Shaffrath proceeds to point at this guy repeatedly, saying, "You see this, Klingler? This is a man who has beaten sarcopenia." It's a picture of a man who's strength trained all his life. And to be honest, it's a picture I can't get out of my head to this day, but it stuck with me in more ways than just the image burned into my brain. It's made me realize that, man, there is a path to still having muscle and health at the age of 80-something. And it's got me thinking, what do I need to do to get myself to the point where I still look like a man, where I have my masculinity, where I have my strength all throughout the course of my life? And here's the truth, guys. When we lose our strength, it's not just about shrinking muscles. It's about losing capacity. Losing our ability to carry, to protect, to fix things, to be independent. And let's be honest, for most of us, if we start to think about losing our strength, we start to think we're going to lose our identity as a man. And as we age, there's this kind of slow erosion of our physicality as men. And if we're not careful, it starts to chip away at our confidence, at our usefulness, and even our dignity as men. But it really doesn't have to be this way. You can stay strong into your 60s, 70s, 80s, even your 90s, research shows, and practical experience, but only if you train the right way. And we're going to talk about that on the podcast today, how to train the right way for the aging man. And the truth is, what worked in your 20s will not cut it today. You need to train differently. You need to eat differently. You need to organize your lifestyle habits differently. And that's what we're going to unpack in today's video. We're also going to talk about why men are more vulnerable to age-related decline than women, and what you can do to stop it, reverse it, and reclaim your strength. So biologically, men and women actually have a lot of similarities, but there are some unique differences that we need to discuss. Men aren't just equally vulnerable to aging-related decline. We're actually more vulnerable. In fact, in the United States right now, the average male lives to about 73, and the average woman lives to 79. So they outlive us by like 6 years. Even though we have more muscle mass, more testosterone, the like anti-aging hormone, women still outlive us. And there's a lot of factors that play into that. Men tend to use drugs and alcohol a lot more than females. We tend to be more risk-seeking than females. We're also just harder on our bodies in general. When we work with a guy in our strength program at Village, typically he comes to us with a litany of injuries and conditions. And men are a lot less likely to come and seek help in our programs than women. I think we're like 60% female, 40% male. So there's a lot of things stacked against men through the aging process. And Biologically, though, at the end of the day, we as men are wired to carry more lean muscle mass, produce more testosterone, and burn more energy at rest. And this is a big part of what makes us strong, powerful, and capable in our youth. But here's the catch. The very thing that gives us an advantage early in life, muscle mass, testosterone, metabolic rate, can become liabilities if we don't maintain them. So after the age of 30, the average man loses about 1% of their testosterone and 1 to 2% of muscle mass per year. This starts to add up pretty quickly if you do the math with this stuff. It compounds. And without muscle pulling on bones and stimulating metabolism, the body begins to shift towards insulin resistance, towards abdominal fat or obesity, towards hypertension, and chronic inflammation. This is what Dr. Jonathan Sullivan, who we did an awesome YouTube video with, love Sully, and what he's doing over at Gray Steel Fitness. If you're on YouTube, you should definitely check him out. He wrote the book Barbell Prescription. He talks about this concept of the sick aging phenotype, and men are ground zero for it. And we see it in the stats. Men are more likely to develop metabolic syndrome, suffer heart attacks at earlier ages, and experience faster functional decline if their strength isn't maintained. And here's where it gets worse. When men lose muscle, it's often catastrophic. We don't just get weaker, we tend to fall apart. One bad injury or hospital stay can wipe out decades of mobility in guys. And we see this time and again in men coming to us for physical therapy at Village. Guys seem to go from I'm doing fine to I'm in a wheelchair way too fast. And like I said earlier, men are actually a lot less likely to ask for help. We have way more females than males, and that's a bummer. That's a real shame. And if you're a guy out there who isn't as healthy as you want to be, I just want to encourage you, go seek out help. Find somebody to work with you on this journey. So let's start with the obvious, most simple principles for aging well, for building strength, for optimizing hormones for men. Now, whether you're a man or a woman, these same principles apply. You need to do progressive overload heavy strength training. You need to do compound exercises, meaning they're multi-joint movements using, your elbow and your shoulder and your wrist joint all at the same time, as in an overhead press or a push-up. You need to get proper rest and recovery, and you need adequate protein and solid other nutrition. Those are just human being basics, whether you're a man or a woman. But men and women are not the same. One of the key differences between men and women comes down to where we hold our body fat and our muscle. But body fat's a big deal. Men have more abdominal fat, and that's typically the more dangerous kind of fat compared to women who tend to hold their fat more in their arms, their hips, their legs. That's actually less dangerous, not as close to the heart and other essential organs within our body, less dangerous type of fat. But the abdominal fat that's right around the visceral organs can be quite dangerous for men. So men are more prone to this visceral fat, and that's the deep belly fat that surrounds our organs. And this isn't the kind of fat you just pinch. This is the kind of fat that increases inflammation, insulin resistance, blood pressure, and heart disease risk. So men tend to not only have more abdominal or belly fat, they also actually hold more fat around their visceral organs themselves. And a 2014 study found that even at the same BMI, men have 2 to 3x more visceral fat than women of the same age. This was a Bradella et al. Study in 2014. And here's something even more concerning. Low muscle mass combined with high visceral fat, which is common in men, also called sarcopenic, which is the loss of muscle, obesity, which is excess fat. Sarcopenic obesity is one of the biggest predictors of early mortality in men. So if this is you, if you are not strength training and you're overweight as a man, you probably are losing muscle or have lost muscle, and you definitely have body fat because you have just checked yourself into this box of being overweight. You probably fall into this box of sarcopenic obesity. And that's kind of scary because you are putting yourself at a 2 to 3x risk of, dying from all causes. So there are real biological differences that impact how men respond to training compared to women. And one of the biggest ways that we're different is through our hormones. So if we're going to talk seriously about how men should train to build strength, stay lean, and thrive, we need to start with one key fact, and that is that testosterone is one of the primary hormones that makes a man a man. And testosterone declines with age, 1% per year after age 30 on average. So men start losing testosterone by the time they're 70, they may have 30 to 40% less testosterone than they did in their prime. Testosterone is our body's anabolic signal that cues us to build muscle, to burn body fat, to maintain bone density, and even to stay sharp mentally and emotionally. See, testosterone, when that signal fades, our body starts to shift into the opposite of anabolic mode, which is catabolic or breakdown mode. This causes us to store more fat, reduces our physical drive, and really erodes at our masculinity. So testosterone is not just about libido, which is what a lot of guys think, or muscle size. It's not less than that. It is those things, but it's certainly more than that. It plays this critical role in all these other areas, even depression, type 2 diabetes, cardiovascular disease. These are all impacted by the hormone testosterone. One of the biggest questions I get from men is, what can I do to increase my testosterone? In other words, what can I do to keep my masculinity and youthfulness as long as possible? Now, thankfully, the very same health habits that are going to help you to increase your testosterone are also the ones that are going to help you to build muscle, to burn body fat, and to be just the healthiest version of yourself. So let's talk about it. Let's talk about training. Let's talk about nutrition. Let's talk about supplements that can actually help you to maintain your masculinity, maintain your muscle, and maintain your health. So number one is training. So we know that training increases muscle in men and women, even very old men. There's a couple cool studies, one done on subjects an average age of 85 that were taken through an 8-week lower body strength training program, and they saw a 44% increase in muscle size and a 50% increase in quad strength just in the duration of the study. But what about hormones? So we know we can increase muscle with strength training. Can we actually increase our hormones, specifically testosterone, with strength training? So to figure out if men and women respond to testosterone differently, researchers all the way back in 1983 conducted a fairly seminal study on the subject. They took 40 people, 20 men, 20 women, and they had them lift weights for about 30 minutes, just solid, heavy resistance training. And they tracked what happened to their hormones over the next 2 hours. Now, before they even touched the weights, the men had 10 times more testosterone than the women. And what they found was that after the strength training session, both groups actually increased their testosterone levels, men by 20%, the women by 16%. There was a statistical difference between the two, so men have a even higher percentage increase than women. But because the levels were so low for women and so high for men before, the actual amount increase was quite drastic for men. It was huge, whereas women was like barely a whisper. And so here's the takeaway. Lifting weights doesn't just build strength in men. It actually activates a hormonal response that amplifies testosterone, muscle protein synthesis, post-exercise fat burning, and more momentum towards aging strong. So I don't know if I would say this to a female client, but I would say weight training is even more important for men than women because of its impact on the hormone testosterone for us as men. So strength training increases testosterone levels in the short term, but does it do it in the long run? And does it work in older folks? Well, a 2006 study looked at how strength training affects hormone levels over time. It looked at 20 untrained men and had them lift 3 times a week, like 70 to 75% of their 1-rep max for multiple repetitions for about a month. And this is pretty hard training. Like 75% of your 1-rep max for numerous reps is challenging. And they found that there was a significant improvement in strength and an increase in the urinary or pee excretion of androgens. So specifically, testosterone was increased in this study. That means even in just 4 weeks, men's bodies adapted, producing more anabolic hormones and getting stronger. So consistent lifting, it doesn't just build muscle, it improves the hormonal environment in our bodies from the inside out. Now, let's talk about the ideal strength training program for a man who wants to optimize hormones and age well. And so from all the literature that I've read, the ideal program needs to check a few different boxes. So these are the same boxes, thankfully, that need to be checked to build muscle. And the first box is that the exercises you pick, they need to use a lot of muscle at the same time. More muscles used equals more muscle protein synthesis stimulated, more hormones released. And so this also is going to save you time, because if you're, let's say doing a hamstring curl, you're just stimulating your biceps femoris or your hamstring muscles, compared to a deadlift where you're stimulating your biceps femoris and your adductors and your gluteal muscles and your back extensors and your grip all at the same time. You're just using more muscle at once. And this is what the research shows elevates muscle protein synthesis much greater and leads to a much higher testosterone response in the body post-exercise. Second, you need to do multiple sets of the same exercise. There was a 2005 study done by Ratmus et al., and they showed that single sets of exercises, so like one set of 10, did not work at all for elevating testosterone levels compared to 6 sets, so multi-sets. So you need to do more than just one set. I think that's pretty self-explanatory. Most people seem to get that. And then this was interesting. You need to train near failure, but not to failure. Now, just about every study that I looked at showed that there were increases in testosterone for like 1 to 4 days after training. But this study by Izquierdo et al. Showed that training to failure actually resulted in higher cortisol levels and lower testosterone levels in men. The cortisol levels cortisol is like the stress hormone within the body. It's more nuanced than that, and I by no means am a hormone expert. But it's not, it is important for us to understand that cortisol is typically associated with too much stress. Like if we have heightened cortisol, we're probably overly stressed. So for men, we need exercises that are, or we need a training that's not going to push us to failure. So for example, if you're doing bench press and you could do 10 reps with 150 pounds, but your form is starting to get compromised, you can actually push the bar up at rep 11, you probably want to train with 7 to 8 reps of that weight, so sub-maximal effort. So the Izquierdo study showed that that's just not possible when you're training to failure, or when you're training to failure consistently in your program, you're going to overtrain. You're going to tax your body too much. I used to train with this guy in college who would do 10 sets of 10 heavy back squats. It was called like Russian volume training. And I remember asking him one day, after one of his grueling 2.5-hour workouts, I was like, hey, do you think you're overtraining? Are you concerned about training too hard? And he told me, he's like, there's no such thing as overtraining. There's only under-recovering. And I think there's some validity to that. I think that people often are not actually overtraining. They're just so depleted and they don't sleep well. They watch TV late at night. They wake up too early. They stimulate with coffee. They drink alcohol in the afternoon and evenings to wind down. And they're just kind of on this vicious cycle of fatigue. And so they don't have much capacity to take on the additional stress of training. However, the aging body just in general doesn't recover as well as the 20-something body. And so we need to think about that as men. We need to do exercise that gives us the right stimulus so that our body adapts and gets stronger instead of breaking down in the long term. Other exercises that increase testosterone: sprinting, like really high intensity, short interval training. Those things increase testosterone. And then endurance exercise, especially like marathon training, moderate high intensity for long periods of time, more than 75 minutes, will actually reduce your testosterone levels and increase your cortisol levels in the long term. Now, I don't think anybody in the literature, anybody would interpret the literature to say that if you go for a 3-hour hike on the weekends, you're going to plummet your testosterone levels. I just don't think that's the case. Interestingly, though, other studies have shown that just about any activity, is better than being sedentary. And aerobically trained older men with like a baseline level of aerobic fitness actually have higher testosterone levels than completely untrained men. So heavy strength training is the answer. It's the solution. It just needs to be submaximal. It needs to be multiple sets, and you need to do exercises that use a lot of muscles at the same time. So my 3 favorites, actually my 4 favorites, I'll say, deadlifts, squats, overhead press, and then bench press. Now, we don't do bench press in our strength programs at Village because we don't want to have benches, and I think you kind of need a spotter unless you have a ton of experience, and our clients do not typically have a ton of experience, and we don't spot each other in the program. So that's why we don't do bench press in our programs, but I still think it's a fine exercise, and I would alternate it with overhead press in your training. I think that's great. I also love push-ups, pull-ups. Those are multi-joint exercises. I like a good lunge from time to time. I'm fine with all those. I think they're all great for accomplishing this multi-joint, lots of muscle at the same time resistance training. It also needs to be heavy enough to matter. Older adults especially need to train at high intensities to maintain their muscle mass, to stimulate testosterone. We're talking 70 to 85% of their 1 rep max to build or maintain muscle and strength. And Peterson et al. Back in 2010 showed that that's kind of the ideal range for the older adult to maintain muscle mass and strength. And that's where the body starts to signal like, hey, we need to keep this tissue alive. And in fact, we may even need to build some new tissue to handle this demand. Light weights just don't do enough to stimulate the type 2 muscle fibers within our bodies. And then heavy weight training also fights the sick aging phenotype that we talked about earlier. You get a muscle mass increase, your insulin sensitivity improves, testosterone and growth hormone will increase naturally, visceral fat decreases, bone density increases, and then even like balance, coordination, stability, those things also improve. Then you also want to choose exercise that you can progress over time. If you really want your body to adapt, you need to progressively overload it. You need to slowly and steadily over time increase the resistance, and barbell training allows you to do that better than anything else. One of the issues I see with guys is that they often want to do the same overhead press weight or the same squat weight or the same deadlift weight or the same bench press weight that they did when they were in high school, even when they're in their 50s or 60s. And what I tell them is you can still be really strong. Like, we can get you quite strong. We might not be able to get you back to where you were in high school, and you should be fine with that. But we need to get there much slower than you did in high school because you have all these other tissues within your body that need to recover. It's not just your muscles. We're talking your tendons, your ligaments, your bones, your nerves. These tissues take a lot of time to adapt, whereas muscles respond pretty quickly. And so we want to pick exercises that we can start at the right level and then slowly and steadily progress by 1 to maybe 10 pounds each workout over time. And so we want to use tools like barbells, maybe some dumbbells, some kettlebells, things like that allow us to do that progression incrementally. Now, I know what a lot of people say, barbell training is too hard on joints, especially as you age. And I think that misses the point of training completely. Now, training is supposed to be a stress on your body. And if your training, specifically barbell training, is causing you pain, it's likely because you're violating one of the cardinal rules of strength training. Using too much weight too soon, you're skipping your warm-ups, or you're progressing faster than your body can handle. So we already talked about the weight thing. We talked about progression, how it should be really slow. Start at a light weight, progress slowly. And then you also want to make sure you're warming up. We use this 5-4-3-2-1 warm-up methodology. We do a set of 5 with like 50 to 60% of your target set weight, a set of 4 with 60 to 70% of your target set weight, a set of 3 with 70 to 80%, a set of 2 with 80 to 90%, and then a final set that's like 90 to 100% of the weight you're going to use. So let's say your target sets are 200 pounds. For my first warm-up set, I might do something like 135 pounds for a set of 5. And that's like in that 50 to 60% range. And I think you can do the math from there. I don't want to have to do it in my head and be wrong. So make sure you're warming up appropriately. You should actually be physically hot before you go into a strength session. So do some cardio. We do one of our other lifts before our big lift just to get people's bodies warm, to get their neurological systems primed for the workout that's ahead of them. And I also want to say, if you're doing all the right things, you're warming up, you're starting at the right weight, you're progressing appropriately, it's still very possible that you have pain with barbell training. And that doesn't mean you throw the baby out with the bathwater. I think that becomes a fantastic diagnostic tool for you to say, hey, there's something going on under the hood with my body. Because one of the other reasons we love overhead presses and squats and deadlifts is because they check all these boxes in the human body. If somebody can overhead press weight, I know that they're going to be negative, in the best sense of the word, for just about every orthopedic test that I learned in physical therapy school. If somebody can deadlift a good amount of weight, I know that their spine is in good working order. Somebody can squat, their body weight, I know that their knees don't have a pathology that we need to rule out. Now, if you do have pain with, say, an overhead press in your shoulder, then we might say, okay, there's probably something going on under the hood in that shoulder that we should figure out before it becomes a big problem. And the barbell exercises help to tease that out and bring it to the surface before it becomes a massive issue. It's almost like your check engine light coming on before your timing belt completely blows up and you have a massive issue and your car can't go anywhere. In human terms, this is like before your rotator cuff totally tears when you're lifting your suitcase into the overhead bin on your long trip to Italy, your shoulder starts to bother you with overhead press. And you're like, I should figure this out. We need to figure out that there's a mobility restriction in that shoulder. Maybe I need to go see a physical therapist and get that checked out and addressed. So now let's talk about how often a man should train. So for most guys, the sweet spot is like 3 full body strength sessions per week. We like full body because older men and women need more frequent stimulation of the same muscle groups, because as we age, our body doesn't respond as strongly to the same metabolic signals with strength training. One study showed that older adults experience a blunted and actually short-lived protein synthesis response after training compared to younger adults. That was Kumar et al. In 2009. We talked about warm-ups. Now let's talk about nutrition. So protein, super important for men as they age. Over 40% of men over the age of 65 do not get the recommended daily amount of protein, the RDA. And I think the RDAs are kind of a joke. Right now, it's like 0.3 grams per pound of body weight. So for a 150-pound dude, that's about 54 grams of protein. A 200-pound guy, it's about 70 grams of protein or so. And certainly that's going to be enough to survive, but it's definitely not enough to build muscle. You just won't have enough of the building blocks for muscle building. So as we age, we face something called anabolic resistance, meaning our muscles don't respond to protein or to strength training as strongly as they did when we were younger. And so we need to actually give them more input, which is why, as we age, we need to train harder. We need to probably do a little more protein. We may even need to consider supplements, which we'll get to. So here's what the research shows for men. The Health ABC study followed older adults for 3 years and found that those who ate the most protein, around 100 grams a day, lost 40% less muscle than those who ate the least. Men were particularly affected as they tend to have more lean muscle mass to lose. Less protein means faster decline in strength, mobility, and independence for guys. There's also a 2020 study in the journal Nutrients that found that higher protein intake, like 0.6 grams per pound per day, so like double the RDA, so about 100 grams for the average guy, maintained better physical performance and muscle strength, especially when combined with resistance training. And then another study in 2023 in the Journal of Nutrition, Health, and Aging looked specifically at frail older men, and they found that supplementing with an additional 30 grams of milk protein significantly improved leg strength and their ability to get out of a chair in 12 weeks. So my recommendation is 100 grams a day, minimum. For guys, I usually go higher than that, like 0.72 grams per pound of body weight. So if you're a 200-pound guy, you're looking at more like 145 grams of protein per day. I shoot for about 160 grams per day for me personally. If I'm trying to gain muscle, I'll even do a little bit more than that. Interestingly, two of the biggest factors, if you look at all of the dietary research when it comes to losing body fat, the two biggest factors are calories and getting enough protein. Like if you look at all the different research studies on diets, people that eat in a caloric deficit and people that eat enough protein, those are kind of the two biggest factors when it comes to driving weight loss. So let's next talk about supplements. And before I do, I just want to say my read of research from talking to experts in the field is that exercise, strength training specifically, is like 80% of the equation when it comes to building muscle. And nutrition, supplements, they're 20%. So strength training is just such a strong stimulus for muscle building. Like you've got to be doing that if you want to build and maintain muscle with age. So let's talk supplements. So protein obviously is whey protein is obviously the kind of like the gold standard protein, and for good reason. It activates the most muscle protein synthesis. It's a complete protein. If you don't have any digestive issues with whey, that's the route I would go. If you do, I'd consider it like a beef protein isolate, or maybe even an egg protein. There's even some research to show that some of the vegan protein options also work for activating muscle protein synthesis, but not quite as well as the animal sources of protein. Creatine is also another supplement that I think men should highly consider taking as they age. Now, a lot of people think creatine is just for bodybuilders. It's really not. It's for anybody that wants to build muscle. We're not going to get into the specifics of what creatine is today, but it does help with hormones. A 2009 study found that creatine supplementation increased DHT, or dihydrotestosterone levels, a more potent form of testosterone than just testosterone, by about 56% after 7 days of loading and 14 days of maintenance. DHT is a critical hormone for men in terms of their vitality and strength. Total testosterone also tends to see a slight increase when you supplement with creatine. And so, yeah, creatine is really powerful. We use Momentous creatine. It's third-party tested and vetted. It's a creatine monohydrate, which is the cheapest form of creatine. It also works just as well as the other fancy formulations of creatine, so I would recommend that one. And then caffeine is also an interesting supplement for men to consider. So most guys think of caffeine as kind of just their go-to for when they wake up or powering through a workout. But the research shows that it plays a significant role for men compared to women. So there was a study that looked at men and women who ran downhill for 30 minutes. So it's a potent way to like increase muscle soreness in the quads. And then they had them on separate days. They took 6 milligrams of caffeine per kilogram of body weight, or a placebo. And the results were really interesting. So caffeine restored strength levels in both men and women after the muscle damaging run, but it reduced soreness by 21.5% in males compared to just 4.6% in females. I think this shows that guys are just kind of wimpy, and we're a little bit more prone to the placebo effect. But hey, if caffeine can be helpful for guys in a unique way, all the more reason to drink lots of coffee. It also lowered serum potassium levels, which are a marker of cell disruption, by like 17% in men, with a much smaller effect in women. So caffeine can help men specifically bounce back faster, feel less sore, and perform better after tough training. There's also some other interesting supplements that I'm not taking personally, so I'm not going to, recommend them strongly. Tonkat Ali is an herbal extract that's gained some popularity recently. It may help to naturally support testosterone and energy levels in aging men. There was this 2012 randomized trial that found that 76% of men with low testosterone who supplemented with 200 milligrams of the stuff normalized their testosterone levels after just 4 weeks. As I was reading through examine.com, which is a great database for literature, this is one of the supplements that was listed very high on its ability to move the needle for testosterone in men. D3 is also up there. Vitamin D, and actually we take a vitamin D supplement, both Nicole and I. It's correlated with lower testosterone and weaker bones, especially in older men. So men with deficient D levels are more likely to suffer from muscle weakness, fatigue, and low mood. As with anything, I want to kind of close with this. I would recommend go and get your blood markers tested. Function Health is a great place to start. Get a complete blood panel from them. Figure out your testosterone levels, your free testosterone levels, and kind of understand where you're at before you even start messing with any of this stuff. And then I didn't even touch on testosterone replacement therapy, or TRT, because that is outside of my own scope of practice. I also haven't experimented with that at all, so I don't feel like I can speak to that. But if you do have low testosterone, I would recommend the things that I've laid out in this video first. Try them for 6 to 12 months, and then consider TRT, because there's so many side effects associated with starting to add hormones to the body. You really start to mess with things when you start adding something external to the mix. So I would recommend trying these natural interventions first. Let your body balance itself. Train hard, train heavy. The future is so available to you, but it's not going to happen by accident. It takes intention, it takes heavy lifting, it takes eating enough protein, it takes showing up even when your body is like, I just need a day off. So if you're a man who wants to age well, you need to train hard, you need to recover well, you need to eat like it matters, and you're going to age like a warrior. Until next time, I'm Dr. Matt, and this is the Strength for Life podcast. Be sure to like and subscribe and leave us a review. Thanks.